Dear Chair, dear audience, let me start our last section today, and thank you for the opportunity to present our research, which is about the role of gut microbiome in acute pancreatitis. My name is Réka Meszéna. I'm a biologist and a first-year PhD student in the Institute of Translational Medicine in the University of Pécs. We have a vision to achieve the lowest morbidity and mortality in acute pancreatitis possible. And therefore, we have a mission to assess the gut microbiome profile of acute pancreatitis patients to create a new treatment strategies. We have two specific goals and two ongoing projects. The first is about comparing the gut microbiome diversity in different severity levels of acute pancreatitis and healthy controls. And we would like to use the methodology of systematic review and meta-analysis. And the second one is about how the microbiome diversity affects the sepsis development in acute pancreatitis. And it's going to be an international observational clinical study protocol. So briefly about the first project and the background. The annual incidence rate of acute pancreatitis is 3 million in the world, and the mortality rate can be up to 50% in severe acute pancreatitis. More than 50% of deaths in severe acute pancreatitis caused by sepsis, and most of the pancreatic infections are due to the gut barrier disruptions, which allows the pathogen bacteria translocations. And there is still no specific treatment or clear guidelines for that. So therefore, our aim is to evaluate the characteristic of gut microbiome in the development of and outcomes of acute pancreatitis. So we came up with a clinical question: is there any difference between the gut microbiome diversity in severe and non-severe acute pancreatitis and the healthy people? So the investigated population is going to be a patient with acute pancreatitis. The exposures are the severe and non-severe acute pancreatitis. The comparator is the healthy controls, and the outcome is the microbiome diversity and the composition of the microbiome. We hypothesized that the intestinal microbiota is different in the different severity levels of acute pancreatitis and the healthy people. Regarding the clinical and research implications, I have to say that if our hypothesis is true, it will still not bring back any changes immediately at the daily practice. However, the better understanding the diversity of the pathogens can help develop prevention and treatment therapies for the acute pancreatitis. So here you can see our systematic search. The first domain refers to pancreatitis, and the second domain covered the microbiome. We have conducted in 3 different databases, and we have found the K articles, which has the same PICO framework, and of course they had strengths and limitations. So they used a comprehensive approach with large and diverse sample pools. There were some limitations, like not all the exclusion criteria were well defined. But I would like to highlight the Ammer and Harmanel study because we can based on them. So we had, after the systematic search, 1,700 articles, and after the application removal, we had 1,337 articles. Currently, we are working on the title and abstract selection with my coworker Abel Farago, and after, when we discuss the conflict, we can move to the full text selection. So let me move to the second project. The title is Investigating the Effect of Microbiome Diversity on Sepsis Development in Acute Pancreatitis. Sepsis is a life-threatening condition which causes organ dysfunctions leading to widespread inflammation, tissue damage, and potential organ failure. Sepsis causes almost 50 million cases and 11 million deaths annually worldwide. And as I mentioned, in severe acute pancreatitis, more than 50% of the deaths caused by sepsis. So our aim is to investigating the microbiome diversity on sepsis development in acute pancreatitis patients. We came up with a research question that can gut microbiome diversity predict the development of sepsis patient with acute pancreatitis. The investigated population is patient with acute pancreatitis. We would like to, we have an exposure to sepsis, and we would like to compare with non-septic patient. The outcome is the diversity of the microbiome before the sepsis, and we would like to add the time to sampling the patient every day during the hospitalization until the inflammatory biomarkers are decreasing at least 2 days. So we hypothesized that the reduced gut microbiome diversity is associated with the increased risk to developing sepsis in patients with acute pancreatitis. I have to say that currently there is no clinical implications of the study. However, if our hypothesis is true, so it means that the patient at the admission time has a reduced gut microbiome diversity, we have to think about the treatment, how to maintain the gut microbiome diversity for these patients, and here comes the research implication. So we have just started to draft the protocol. We would like to include only adult patients, and the intervention is fecal and rectal swab sampling every day during the hospitalization. And the primary outcomes is the severity of acute pancreatitis and the development of the sepsis. So as a summary, we have 2 ongoing projects, and we are planning to submit the first one in May 2025, and the protocol in September 2025. I would like to finish my presentation with the words from John Maxwell: if we are growing, we are always going to be outside of our comfort zone. Thank you for your kind attention.
Thank you. It was a very interesting presentation. I'm just wondering that how much does it cost, and the availability of this microbiota examination is today in Hungary, maybe? Is it available or not? Is it expensive?
Yes, I cannot say the exact cost, but it's available, and so we have a contact already with the Institute of the Santiago Tarry Research Center, and we are going to think to have a co-worker.
May I please ask, how is the microbiome diversity assessed exactly?
With metagenome analysis, and it's a very, very strict process. So we need a whole bioinformatic team to clean the genomic analysis, because the human genome and also the bacteria will be in a combination in the samples. So it's a very complex.
Do you have specific species of microbiome which you want to assess?
So in the results, we will see everything, all the genes or all the whole genomes related to the bacteria, and not just one specific. We can identify them by the DNA.
Okay, that sounds very interesting. Thank you.
Réka, this is today a hot topic, and not only in the acute pancreatitis, but in the hepatology field. Do you have any relevant data from the literature about the fecal transplantation and the acute pancreatitis correlation?
There is no too many article yet, so we are waiting for more, maybe. And I know that it's a really hot topic, but so I'm not sure that how the results will be, for example, with the fecal transplantation.
Congratulations on your presentation. It's a really interesting topic. I'd have a general question. I'm not as familiar with the gut microbiome, but in the urinary microbiome, there are significant differences based on gender due to the anatomical differences of people. Are there any differences in the composition of the microbiome for men and women in the gut microbiome that you know of?
Thank you for the question. I don't know yet. I know that there are many factors which change the microbiome. So for sure that we will need to have some subgroups, but related with the gender, I have no information yet.
Okay, thank you.
I have one more question. I'm not a pancreatitis expert, but are there any differences in the microbiome in case, let's say, alcoholic pancreatitis or with an other origin, let's say, inherited pancreatitis?
Yes, I'm sure that there is
because
differences.
then in that case you have to differentiate
yes.
among your patients what
yes,
is the
absolutely.
origin of the acute pancreatitis.
Yes, and also we have to subgroups with other comorbidities or drug intakes or so on.